is estimated that the number of hypertensive adults will increase to 1.56 billion by 2025. The prevalence rate of hypertension among urban population has been pegged at 54.6% against rural and prevalence of 19.3%. That's the rural areas. More troubling is the fact that the levels of hypertension detection, treatment and control in Ghana has been generally low over the years, and this, we are told, will lead to an increased burden of hypertension in Ghana as life expectancy increases with rapid urbanization. These revelations are not just scary, but also brings about the conversation of why young people are being attacked by these diseases. Is it lifestyle, negligence, or, is it that we're simply unconcerned about our health? Well, 2025 may seem to you a very long time, but no, it's just 8 years away from now, which is in essence very, very close. The question remains, how do we deal with the canker? On PM Express tonight, we'll be focusing our discussion on lifestyle diseases, including diabetes, obesity, alcohol-related diseases, stress issues, and the list goes on. I have two powerful doctors in the studio, and I'm assured by the time we leave here, you and I will make one or two changes to our lifestyle. Stay put. A very interesting conversation awaits you after this break. Welcome back. This is PM Express. We're discussing the very things that kill us, our lifestyle. Are we living a healthy lifestyle? We will soon find out. My name is Aisha Ibrahim. My guest tonight, Dr. Denise Adai-Lai, Programs Manager, Non-Communicable Diseases Control Program, and he's at the Ghana Health Service. And Dr. Joseph Atia Akama is an interconventional cardiologist and lecturer at the Department of Medicine and Therapeutics at the Kolebu Teaching Hospital. Gentlemen, you're welcome.
Thank you very much.
Thank you.
And you at home can also join the conversation via phone. I'll be announcing the lines very soon. Now, let's start with you, Dr. Lai. Dr. Lai, definitely if we're told that by 2025 we'll be getting to 1.56 billion, of hypertensive adults, that's very scary. But how do we deal with this situation? That's the global situation. Let's come back to our home and see how we can begin to deal with it. But we wouldn't be able to do that until we know our situation now. What's the prevalence rate right now as we speak?
Thank you very much. I think you mentioned some statistic, and sometimes I want us to be very careful with the interpretation we put to the stats. The 54%, or was it 56%?
54
in the urban areas.
In urban areas, 54.6.
I am sure it was within a certain age group.
Yes, we will come to that.
Yes.
But we want to begin at a very comfortable level. We need to know our prevalence rate at the moment. So
one of the best statistics we have on hypertension in Ghana is the last Ghana Demographic and Health Survey, because that looked at a representative sample of the population of Ghana. Among males, it's about 15% if you looked at people aged between 15 and 45 years. Now, we have to be careful how this is interpreted, because hypertension generally is a disease of older people. Yes. So when you look at the population 15 to 49, and we say it's 15% amongst males, then you're likely to think it's not that high. But if the 40 to 49-year-old group is taken, then it's about 38%. So I'm sure the 50-something plus percent you quoted might be for a much older age group, and that would not be surprising. But that does not mean that 56 or so percent of adults, 54.6% of adults in Ghana have hypertension. Again, amongst females is a similar thing. So it's about 12. Males is about 15%, 12.5% for females. And if you look at the older age group, 40 to 49, it's about 33%. So generally, there's an increase across the age. So that is an idea of what the state is of hypertension in Ghana. Various studies come out with various estimates, but the general thing is that we have hypertension, the trends going up from the various studies over the years. So that's the key thing. I wouldn't want us to dwell so much on what percentage it is.
The trend is going high. It's going high. How is it like with the young ones? Because what we're told is that the young people are catching up. You said it's an old age disease, but I'm not sure the trend is still the same, that it's only old people who get this kind of disease.
Okay, so the trend about age is that generally as the age increases, you're likely to have a higher percentage of that age group having it.
Okay.
But having said that, as you rightly said, it's also becoming commoner amongst younger people.
Okay.
So let's say in the 1960s, people between 20 to 25, and I'm just using this as to illustrate. People between 20 to 25, the prevalence of hypertension may have been 1% or 0.5% in that age group.
Before?
Maybe during that period. It may be about 5% now.
Okay.
So for that age group, it's also moved up from 0.5% to that high proportion.
Right.
So you will still have adults having it higher, but the rates amongst younger people is also going up.
It's going up.
Yeah.
Doc, what could be accounting for this? First of all, let me ask if you're surprised about this rising trend.
No, I'm not surprised at all. Good evening to your listeners and viewers. This part of the presentations we've been doing all this while, the prevalence of hypertension is not surprising at all. It's been predicted several years ago, and we're seeing it now. He's from the Minister of Health, and he's telling us what they have been seeing. As a clinician dealing with patients day to day at Kolebu, you say everybody has hypertension.
Everybody has hypertension.
Yes, because that is what I am seeing.
Okay.
In my bowl, everybody has hypertension. In his bowl, he looks at the whole of Ghana. So you have to look at the perspectives. So the interpretation that the 54% you gave was about a woman in Accra.
Okay.
About women in Accra, urban center. They studied them and they found that 54% have. And that is, by the way, using the old criteria of 149/90. There's a new criteria. Have we adopted it yet or not? But if we adopt the new criteria that the US has just released, 130/85, then the 54% of women who had hypertension is going to be probably 70%.
Okay.
So Minister of Health is here to guide us as to whether we should use the new guidelines or not. But having said that, the prevalence of hypertension is alarming. It's alarming.
Very.
Very. There's no day in, day out that you won't get a patient coming with a stroke because of blood pressure, heart failure because of blood pressure. So in terms of clinical work, it is the #1 reason why people go to the hospitals.
Right.
For our patient, and now the Ghana Health Service statistics shows that it's also #1 reason why people get admitted.
Okay.
And maybe the #1 reason why people die. If you take just adults, now if you take the whole Ghana, including children and everything, then you have a dilution of the statistics.
Okay.
But if you just take adults who go to a hospital, what kills them is probably #1.
And of course, the Ghana Health Service has said
The data has said
it's killing more adults than any other disease.
Right.
But are you able to tell what could be accounting for this trend?
Sure. He will also talk about some of these risk factors, but hypertension is one of the diseases we term as lifestyle diseases. What are lifestyle diseases? These are diseases that are classified as non-communicable diseases that come as a result of bad lifestyle habits. Basically, the biggest one will be physical inactivity. eating too much salt, too much sugars, too much fat in your diet, not exercising, and then overuse of alcohol and smoking.
Okay.
And in Ghana, I want to stress that overstressing yourself. We do so many things at the same time and overly stress ourselves.
Right.
So when you combine all of this, they result in high sugar levels in the blood, they result in high cholesterol level in the blood, that's fat levels, they result in obesity, and then they result in high blood pressure.
Okay.
So when you have all of these factors, then you're likely to develop the non-communicable diseases. And number one is cardiovascular diseases.
Very, very troubling.
Yes.
I will come back to Dr. Lai and find out, because we're told that the hypertension detection, treatment and control has been generally low. So let's find out the reality, what is on the ground. I'll take a break on PM Express. When I come back, I'll explore that. Welcome back to PM Express. Hypertension is killing more adults than any other disease. That's the topic for discussion tonight. We're looking for the way forward to reverse this trend. And before I went on the break, we were looking at the fact that hypertension detection, treatment and control in Ghana has been gradually slow. Let's look at the trend. I mean, what is on the field? Dr. Lai.
Thank you very much. So I think hypertension is probably one of the easiest disease conditions to diagnose.
Okay.
The level of expertise needed, and particularly now that we have these electronic gadgets, it's very easy to train somebody to be able to check the blood pressure. So it's in terms of diagnosing, I don't think that there's a lack. We have people who are
My understanding has been that probably people don't offer themselves for the check.
So again, that is one of the key findings in the last demographic and health survey. Amongst the people for whom they checked their blood pressures and they found them to be high,
Okay.
I think about 80% or so were not known to be hypertensive or have hypertension or been told by any health worker that their blood pressure is high. So that is one of the key things. Because as I said, it's very easy to train somebody to check the blood pressure. In times past, when we depended a lot on the mechanical ones, there you have challenges. So two people can measure and they'll give you different figures.
Okay.
In fact, as medical students, when we're training, sometimes you find that happening. But particularly now with the electronic ones, it's quite easy to diagnose it. So I think it emphasizes the point that we need to get people to be screening, and particularly now that, as my senior colleague mentioned, we've dropped the cutoff has been dropped globally, and with time we'll follow suit. Generally, these standards are set elsewhere. We, adapt to them. So most likely we'll follow suit, which means that it's even going to be lower now. So to diagnose somebody with high blood pressure, the cutoff is going to come down more. And now, as we also said earlier on, there are younger people who are also coming up with high blood pressure. So it also means that initially we used to preach that from 40 years you have to go for regular screening. With a drop and also the observation that younger people are getting it, we have to revise that age cutoff as well. So we might probably start even looking at 30 years.
Okay.
Depending on what we agree on. But this is where I think that we'll be going. And then, people should take advantage of every situation. If somebody comes to the hospital, say with symptoms that suggest that the person has malaria, and the person has passed a certain age, we must necessarily check the blood pressure as well. And then I think corporate institutions like yours, for example, can be routinely offering such services to your staff, so that can also be a way to be able to pick some of these things. Because as we said, it's more common in urban areas, and particularly for those of us who are doing these sedentary style jobs where we spend a lot of time sitting, very little physical activity. We have to be be doing those things.
So desperate situations need desperate measures, and I want to think that the Ghana Health Service is devising ways of dealing with this alarming situation. We'll get to that, but Doc, let's look at the related diseases, and diabetes has been tagged as one of the biggest contributor to hypertension. We're told that it's blood in the sugar. We're told that we have type 1, type 2, but the difference we do not know. At what level it becomes dangerous, we do not know. At what level it metamorphoses to hypertension, we do not know. Can you help us with that?
Well, to begin with, diabetes is also on the rise, just like hypertension.
Definitely.
But they are not, even though they fall in the same category like the non-communicable diseases. They are not
related.
Directly related.
Okay.
Diabetes does not give rise to the hypertension. Neither does hypertension give rise to diabetes. However, the risk factors for both of them can give rise to both of them.
Okay.
Yeah. Okay. So, for instance, we mentioned the risk factors for lifestyle risk factors, not exercising, eating too much salt, too much carbohydrates, too much fat. These things and getting big will predispose you to getting diabetes, will predispose you to getting hypertension.
Okay.
So, and both of those factors are getting higher in Ghana because the risk factors are also getting higher. A lot of people are not walking the way we used to walk. We're eating fast food, name it, noodles with salt and everything, eggs coated with salt, a lot of palm oil, immersed soup. You pick the soup and the whole bowl is full of oil. Those things are increasing. And once they increase, what it means is that the cholesterol level of Ghanaians is going to go up. The sugar levels of Ghanaians is going to go up.
Right.
And then that leads to the diabetes, high cholesterol related conditions, and high blood pressure.
But there are also other related diseases. What are these? We can talk about stress levels.
Correct.
We can talk about alcohol intake. In fact, young guys, for instance, in Ghana today, it's become part of their lives.
Correct.
They can't quit smoking. They can't quit. Most of them, I can't say all of them.
Correct.
They can't quit smoking. They can't quit alcohol intake, and a lot of the lifestyles, which I'm afraid is also leading to hypertension.
Correct.
So how is the link? How is it linked to hypertension?
Right. So lifestyle changes are very important, especially in the young university students, teenagers. They want to experiment. And that is what teenage is supposed to be, experiment.
Okay.
But when they overdo things like indulge in alcohol, by far, alcohol is the leading cause of hypertension in the youth. Okay, outside the obesity, which is becoming a problem in the young people. But most young adults, when they come to you and they're hypertensive, evaluate them carefully, and you find that they are drinking. If you stop the alcohol, the blood pressure goes away.
Okay.
That one is guaranteed.
Right.
So in the university students who drink a lot, you're likely to have high blood pressure. So alcohol is also a cause of high blood pressure. Apart from that, alcohol damages certain things. So overindulgence in alcohol will damage your liver, will damage your brain, your nerves, and then even your sexual organs. If it doesn't damage your job and your home. So alcohol is something that we use to a limited extent for social events, but when you overdo it, it becomes a problem.
It becomes a problem. How about aphrodisiacs? We know that the young guys today are also jumping on this kind of thing.
Correct. It's a lifestyle, the peer pressure and other things, because there's no reason why somebody who is under 40 should need enhancement.
Exactly.
There's no reason. But if the person is indulging in alcohol, of course, he's going to have weakness in the whole body will be weak. And he thinks that by taking aphrodisiacs, he'll be more powerful. It rather will damage more things, and he might not be able to live as long as he would have wanted to. Some of the aphrodisiacs have compounds that can predispose you to conditions, high blood pressure. Some of them have ephedrine-like compounds that gives you power, sort of. But in essence, it just predisposes you to cardiovascular problems, like arrhythmias, heart rhythm problems, high blood pressure. So some of the aphrodisiacs that are not labeled and are not well made, we don't know all the constituents. But what I do know is some of them contain powerful ingredients that enhance your well-being. Okay. Like very high concentration of caffeine, it's not good for you. Okay. Very high concentration of drugs that increase your adrenaline level is not good for you. So those would definitely lead to high blood pressure and heart conditions.
And we know that when you have hypertension, definitely there's a level that can be controlled. At what stage does it turn into stroke? And then we know that, I mean, we are losing it. Yes. But let me get Dr. Lai's point on how the Ghana Health Service is trying, or what are your plans in reversing this situation, this alarming situation?
Thank you very much. I think so that the two parts, the preventive parts, and then of course the clinical or the treatment part. With the preventive, a lot of effort is going into that area. So we have a lot of public health staff who are involved in educating the public on hypertension, on screening, and those other issues. In fact, the health promotion unit, which used to be a department under the Family and Reproductive Health Division, has now been carved out and is going to be a division on its own, because they want to focus a lot on promoting health. So this is going to be a whole division with its own staff, with its own programs, to be able to look at it from that angle. Right. And I think that would be coming on board very soon. Okay. So that is going to be one angle. Right. As I said, in terms of skill or training for people to be able to diagnose, at the very basic level, they can be able to check for the blood pressure. So the important thing now is to be able to get people whose blood pressures are high but have not come into contact with the health system. And that's one of the things about hypertension anyway. For most people, there will be no symptom. There will be no symptom. In fact, if you get a symptom based on hypertension, it's a bad sign. It just means that it's got into a complication.
Okay.
So for most people, it's not. And you just walk around normal. So it's important that these will come into contact with the health system. So even though we are looking at promoting health, we also want people to take up the screening services that are available. And those are the two angles we are coming from. There are other aspects. My senior colleague mentioned a lifestyle. Some of the things are such that our system doesn't allow you to even want to live healthy. Okay. Or, for example, physical activity. Okay. When we were growing up, or when I was a child, we used to live somewhere at Bavana Down, and you could only get trotro when you go to a Bavana junction. Okay. So you are compelled to walk up to the junction. Now trotro goes to every neighborhood. Okay. So even though in times past it used to be a disease affecting, let's say, the affluent, because they were the ones who were living the sedentary lifestyle. Now it's cutting across, because even people who are not affluent are also living sedentary lifestyle. Okay. They are having access to the chickens, which used not to be. Meat was not something that was consumed regularly.
You consume it on Christmas Day?
Yeah, now it's regular, and it doesn't matter what socioeconomic class you are in. Okay. So those factors are in there, and that's where the individual efforts also have to come in. The health service or the health system can do so much, but there's an element of individual responsibility, looking at these issues and seeing how we can also live healthy. I know there are a lot of Keep Fit clubs and other physical activities going on. Sometimes after some of these activities, what do we see? People end up going to sit down and eat some big bowls of whatever meal with a lot of meat and alcohol. So yes, so it becomes cost 90, or maybe some people say they are neutralizing it. Okay. At least they've exercised and they are putting back what they lost. Sure. But I think that a lot of it will also depend on us as individuals.
But in terms of policy, are you thinking of some recommending to government what some of the policies we can take to deal with this situation? Let me get Dr. Nkrumah take on this. You mentioned that when you start seeing symptoms, it means that, I mean, you're losing it. What are the symptoms of hypertension? I mean, what will make you think that, okay, now I'm getting there, I need to check myself?
Yeah, let me just digress a little bit by saying that in terms of policy, as a matter of agency, I think the Minister of Health has to elevate the non-communicable disease platform to the highest level.
Okay.
The reason is it's #1 cause of death in Ghana. And there's no reason why up to date that unit where he works, it should be a unit in the Minister of Health, not even the Minister of Health. It is in the Ghana Health Service, which is under the Minister of Health. So that means that we are not really looking at non-communicable diseases as it should be as important as it is now.
Okay.
Who should be importantly interested? The National Health Insurance.
Okay.
They should pick this up, because if they are able to control non-communicable disease, their payout goes down.
Okay.
So they should be leading this. They should really pick up the non-communicable disease platform and work on it.
Okay.
Having
if
said
you talk about elevation of that unit, what would you want to see so that it will befit its status?
Well, let's not take the horse out of the race yet by digressing too much into policy, because that might be another time. But we want to educate our people.
For the, I mean, for the long term.
So we will come to it later on.
Okay.
In terms of hypertension or disease manifestation, there are stages.
Okay.
Initially, when you're exposed to a disease element or risk factor, you have a duration of time to manifest the disease. Then when you get there, you have the symptoms.
Right.
So hypertension sometimes can take many years before the disease manifests.
Okay.
And normally, we detect hypertension through screening.
Okay.
That is the only way you can detect hypertension. And once you detect it during screening, then you initiate secondary measures to prevent the disease from causing harm. Some unfortunate instances happen when the person just presents for the first time with a stroke. It doesn't mean that he just had hypertension overnight. He had hypertension probably for a year or two, and now comes with a stroke. So what are the symptoms of hypertension? Headache, dizziness, weakness on one side, chest pain, leg swelling, shortness of breath. Now you used to walk upstairs without having to stop. Now you cannot walk that far, you get short of breath. When you have all of these symptoms, blurred vision, some funny symptom that you can't explain, maybe weakness on one side, which might have gone away, or very excruciating headache, you need to get help.
Is numbness part of these symptoms?
Numbness is a vague symptom that can go with so many things. Numbness usually is a nervous problem, nerve-related problem, which could be related to hypertension. So if you have hypertension that causes stroke in a small location, it can cause numbness in one part of your body.
Right.
But generally, numbness could be related to so many other things that are related to the nervous system.
And just before we come to the policy discussion, you can join this conversation via 03022111691 or 03022111692. Share your experiences with us. If you have some questions for the two doctors, they're willing to answer your questions. But Doc, what can we do, Dr. Ankama? What can we do? Dr. Lai talked about the food we eat, what time we eat those foods, what we do before and after eating the food.
Okay.
What kind of exercise do we engage ourselves? Do we go for regular checkups? I mean, what can we do to avoid this? I mean, certainly this is alarming. We need to control it.
I think the Minister of Health is doing a lot of work on this. His unit probably is leading the fight. For instance, they just released a registry on cancer diseases, isn't it? So they've started a registry on cancer diseases. We are waiting for registry on cardiovascular diseases. We're waiting for registry on other factors that affect non-communicable diseases.
Okay.
But in terms of individuals, we have to get ourselves checked. We have to, once you are registered with National Health Insurance Scheme, go to the doctor regularly because it's free. Just go there, they check your blood pressure. And then they can document. Once it begins to go up, you will know. I have a patient who brought his blood pressure for the past 5 years. Very impressive.
Okay.
I was like, wow, people like that exist in Ghana. You can see that when he was in the university, his blood pressures were down. And then when he started working, they began to creep up. And now he is in American category stage 1.
Wow.
So you can see that he's gradually getting there. And his father has high blood pressure.
Okay.
So we're going to intensify his medications.
Okay.
I mean, a non-medication approach.
Right.
And hopefully we can get him back to normal range.
Right.
You have to get checked. If anytime you go to hospital, for any reason, get your blood pressure checked. And then workers have to agitate for, apart from salary increases, agitate for healthcare benefits that include regular screening.
Okay.
And make use of them.
Talking about the workplace, I think one of the most things we find at the workplace is stress.
Correct.
Stress levels go up. You want to impress your boss, you want to make money, you're waking up too early, you're sleeping very late, but you still have to make that money and you need to impress your boss. Yeah. And your health is also important. How do you manage this too? Because they all must come together to make our lives meaningful. Correct. Let me take another break on PM Express. When we come back, very interesting conversation we're having here. Welcome back to PM Express. We're discussing lifestyle diseases. We're told that hypertension is killing more adults than any disease. The number to join in this conversation is 0302211691. 0302211692. Let's hear from you. Immediately, I'm told Kojo is on the line. Kojo, good evening to you. You're calling from Sunyani. Let's hear you.
Hello, good evening.
Good evening to you, Kojo.
Yeah, thanks. Yeah, I'd like to find out if nausea is also a symptom of pain.
All right, thank you very much. Doc will address that. He wants to find out if you're feeling, if nausea is one of the symptoms of hypertension.
So nausea, Kojo, good evening. Nausea is a symptom of feeling like vomiting.
Yes.
And it's usually with the gastrointestinal tract. And it has to do with nerves and things that supply the gastrointestinal tract. Nausea should not be part of hypertension unless it is severe hypertension that has caused complications. So if somebody is having nausea, vomiting, with headache, normally we suspect that he has very high blood pressure that has compromised his brain.
Okay.
To the fear of maybe a bleed inside the brain, or the brain is inflamed, or just overburdened by the blood pressure to the level where it's swollen.
Okay.
And they can have nausea in that case. But just mild blood pressure, even moderate high blood pressure should not cause nausea.
Shouldn't cause nausea. I'm told there's someone else on the line. Good evening to you. Okay, we lost Samuel. Godfred is also on the other line. Where are you calling from, Godfred? You're on PM Express. Well, we lost both of them. Let me come to you, Dr. Lai. So we are told that in India, for instance, there's a policy that takes care of some of these diseases like stroke, which is an extension of hypertension and all of that. That's a good idea. Are you considering some of these things so that you can recommend to government?
Thank you very much. I think there are already existing policies. If you look at our National Health Insurance Scheme, hypertension treatment is covered. And as my senior colleague mentioned, if for example, we invested in prevention, then the claims that go to the Health Insurance Authority as a result of people attending because of hypertension or diabetes is likely to go up. So it's covered.
Okay.
I know that even when you get complications, people with stroke, the benefits package includes services such as physiotherapy, for example. So we do have quite an extensive system. I think the only things that sometimes we have challenges is when there's kidney failure and you have to do dialysis. Dialysis, I think, is not covered, but with stroke especially, getting physiotherapy and the other care they need, it's covered by health insurance. So we have quite a good system in terms of managing people who have hypertension. And as I said, it's available from the very lowest level where they can do screening. And if you come to, so we're talking about the CHIPS compounds, they can be able to check for high blood pressure and the likes. If you move to the health center, there are some medications for treating hypertension which can be prescribed at that level before you get to the hospital level, and then even higher to the teaching hospital level where the likes of Dr. Ankama are, where they can do the very high level treatments. So
look, many think that the Ghana Health Service can do better than it's doing now. We'll check out what your challenges are. But let's speak with Danu from Laura. Good evening to you. You're welcome on PM Express.
Good evening.
Let's hear you, Danu.
Yeah. Good evening to you, Choice viewers. I want to know from Dr. Ankama. Is it the case? Yeah, hello?
You're still on air, Danu.
Yeah. Is it the case that people who take medications on hypertension will always have side effects in the near future?
Okay. We've noted that Doc will take care of it. Godfred is from Sunyani. Godfred, let's hear from you.
Yeah, hello.
Godfred, you're on air. Let's hear from you.
Yeah, we thank you for the program, enjoying the program. My contribution, for my question is that, you see, we always talk about the use of chemicals, especially these chemical fertilizers, which we stay on our crops. And one time observed that it is causing a lot of harm the entire society, even as a whole of us. So my question is, once we have identified this to be a problem, how is it that we still allow chemicals imported into the country? Hello?
All right. Thank you so much. We'll deal with that. I'm told Ibrahim is from Mankanso. Hello, Ibrahim. You're on PM Express.
Good evening, Madam, sir.
Good evening, Ibrahim.
I want to know about the pressure because my mother gets asthma. I want to know something about it. The pressure, is it the same with asthma or not?
Okay, thank you very much. He wants to know. Okay, and let's take our last call from Mahmoud, who is calling from Bolga. Mahmoud, good evening. Thanks for joining us.
Yeah, good evening, Aisha, and good evening to your panel members.
All right, let's hear you, Mahmoud.
Yeah, I just want to know that if you have a BP of 110/80, can that be interpreted as low BP?
Okay. Doc has taken note of that. He'll respond to all the questions. I think we should respond to the questions. Okay. Then Dr. Lai will tell us what their challenges are and how we can deal with it.
Okay. So about the side effects of blood pressure, it's always a big problem when people are told to give chance to the doctor to give them a BP medication. And that's one of the reasons why adult males do not like to go to a doctor. Okay. Because they've heard, their friends have told them, if they put you on the medicine, you're going to have side effects. And what are they talking about? Impotence.
Okay.
Impotence. And so men are very worried about impotence. Okay. Especially Ghanaian men. We do not like impotence. So unfortunately, I would rather prevent hypertension and prevent stroke.
Okay.
And maybe
forget about
my impotence. Okay? And even if I become impotent, the doctor can give me new medications that are even stronger
to help.
So if I get a stroke, my little man has no use. I can't even stand up, not alone to perform. Okay. You understand?
Right.
So I think men have to really be realistic and say, yes, there are side effects, but I have to control the blood pressure. And then the doctor will help me control the side effects.
Okay.
Having said that, everything that we do in life have side effects. When you're driving a car, there's a side effect. Definitely. You can be hit. You can't. So there's no medication that hasn't got side effects, but we always balance the bad aspect to the good aspect. And by far, most of the blood pressure medicines have better profile in terms of side effects than the older medications.
Okay.
So if they put you on medicine and you have side effects, please discuss with your doctor. He can reduce the dose, add another medication, and give you some medication to compensate for the side effect.
Okay.
Godfrey talked about chemicals, fertilizers. That is a big topic. I'm afraid, Godfrey, we cannot discuss this in length here. I'll let Lai talk about it briefly. But I agree with you. There's something now being promulgated in elsewhere called like organic
GMOs.
GMOs and things like that. So we have to go back to our way of farming. The problem with overpopulation is that you have to feed people.
And
to
you
feed
need
people,
to devise ways of
you have
doing
to devise ways to get these things done.
But
so,
our farmers are saying that their produce are getting spoiled because we've developed interest for foreign things, even tomatoes.
Yeah.
We want to go and buy it at Accra Mall and
That's
stuff
what
like that.
I said this is a big topic
that needs to be dealt with on another day.
Ranging from fertilizer crops to tilapia, overgrown tilapia, very huge tilapia.
Tilapia that grow in 3 days.
Yes. So Abraham, asthma is not the same as hypertension. Hypertension has to do with blood pressure, the pressure within the blood vessels. Whereas asthma has to do with your lungs. So your mom is probably having problem with the lungs. However, there's some group of patients who are misclassified as having asthma. But in actual fact, they have heart problems.
Okay.
So it's better to go get checked, have your mother be thoroughly examined by a very good qualified doctor, listen to the lungs, check the blood pressure, let them get an echo, make sure her heart is okay. Before you can say that it's 100% asthma.
All right.
But asthma has to do with respiratory problems.
Respiratory problems. Now, Mahmoud
talked about low blood pressure.
Yeah.
Low blood pressure is when the blood pressure is less than 100 and the person is dizzy, symptomatic.
Right.
Why am I adding symptomatic? Because there are a lot of women, young women like yourself, who have low blood pressure, probably 90, but they are not dizzy.
Right.
That doesn't make them have low blood pressure.
Okay.
But low blood pressure should be relative. So if your blood pressure is 118/80, you are perfect.
Yeah, I mean, it falls under the normal range. Okay.
But when it goes below that and you feel dizzy, then you may say that I am having
a low
blood
pressure. Dr. Lai, what has been the challenge of the Ghana Health Service? Because many things that, I mean, you can back up, you're not meeting their expectation.
I'm not sure, particularly for hypertension, whether I can really pinpoint challenges. So let's go through the spectrum. First of all, in terms of screening, as I said, the skill or the ability to be able to make the diagnosis is there.
Are you able to cover the whole country?
So the delivery of healthcare in Ghana is not only by the Ghana Health Service. We have a lot of other institutions. We have what we call the quasi-government hospitals, so police hospital, military hospital, the university hospitals. We also have the faith-based organizations providing healthcare, so both Christian and Islamic institutions. And then we have private sector as well. And don't forget that the National Health Insurance Scheme has made private healthcare also readily accessible to people because there are a lot of private facilities that accepting National Health Insurance Service. So it's not just the Ghana Health Service. And as I said from the beginning, quite a significant proportion of people with high blood pressure are not known. So that is the critical thing, and I think that
are you not doing enough campaign awareness creation?
So Ghana Health Service at every opportunity does that, but most of our education, particularly in the health facility settings, are being targeted at people who are already ill and are in the facility. We do outreaches as well, but to the extent that there's a significant proportion of the population who have high blood pressure, who are not on treatment, or for whom the diagnosis had not been made until the survey, we are saying that it indicates that whatever activities are going on has still not reached the point where we can be able to pick everybody and treat. And so there's still something to be done. I think that viewers, for example, would take some information from this program and would probably go and get themselves and check for high BP. So these are all opportunities that we take advantage of to do. But there's a lot that the general public must do themselves, because we can only screen you, for example, if you bring yourself.
Okay.
So if you don't avail yourself, then it's difficult.
I think we've run out of time. Just in 1 second, Doc, tell us, how can we prevent some of these things?
Right. Just briefly, why should we go to church every Sunday and not be able to check your blood pressure? Why should you go to the mosque every Friday and be not able to check your blood pressure?
How regular should we check it?
I think at least monthly. If you don't have high blood pressure, monthly. If you have blood pressure, weekly. If your blood pressure is not well controlled, every day, depending on your doctor. But if we don't take it as individuals, the way we go to church to pray, then we're not going to hold this thing very responsible.
Well. The cue I take from this discussion: let's eat well, do regular checkups and regular exercise, and that is our insurance for life. I would have loved to go on and on and on, but of course that's all time will allow us. Thank you very much, Dr. Akama, for joining us. He is an interventional cardiologist. Thank you very much, Dr. Lai. He is the program's manager of non-communicable diseases at the Ghana Health Service. Thank you so much, you at home, for joining the discussion and watching us. We are really privileged to engage you. My name is Aisha Ibrahim. God willing, on Monday, we'll bring you another exciting edition of PM Express. Enjoy the rest of our programs.